Hi, I'm Tori, and I am a doctor of physical therapy who specializes in pelvic dysfunction, and I think that pelvic health and pelvic issues should both be more openly discussed and widely understood because everyone has a pelvis. So today we are going to talk about chronic non-bacterial prostatitis and offer potential treatment ideas and interventions, because although it is the most common type of prostatitis, it is not well studied, defined, or understood, making it difficult to treat. Usually prostatitis is treated with Cipro or a similar broad-spectrum antibiotic. Cipro is definitely a powerful antibiotic, and it is effective in treating a wide array of bacteria. However, it is not effective in treating all bacteria, and sometimes it's prescribed without a culture, which means it's prescribed without knowing which specific bacteria, if any, are actually causing the prostatitis. I encourage anyone watching to consider asking their physician for an expressed prostatic secretions test if you haven't already, as this test can be used to culture your unique prostatic fluid, see if bacteria are causing your symptoms and what specific bacteria are, if that's the case, and inform proper tailored antibiotic treatment. Here's the other thing about Cipro. It's an antibiotic, not an antifungal, and we have emerging evidence that suggests that prostatic fungal infections can mimic the symptoms of bacterial infections, and fungal infections are often overlooked and they're not always tested in cultures. Here's a 2013 study that included 1,000 men with chronic non-bacterial prostatitis who were unresponsive to antibiotic treatments that were treated with an antifungal regimen. 80% of them improved. This study's results would also suggest that these fungal infections are more common in men under 40, but regardless of your age, if you haven't had a urine test or prostatic biopsy to specifically rule out a fungal infection, consider asking your physician. And don't let someone just give you an antifungal. The test is important because knowing the specific fungus at play is important. Most antifungals target Candida albicans, and non-albicans Candida species can also cause prostatitis. Finally, if you have truly ruled out bacterial or fungal infection, research prostatic massage, research Saw Palmetto and its partnered supplements, and consider pelvic physical therapy. Sometimes a pelvic floor spasm can cause symptoms that mimic prostatitis. While a spasm wouldn't cause bleeding or abnormal discharge, it could cause pain or difficulty during or after urination and defecation, urgency frequency, painful ejaculation and other kinds of sexual dysfunction, and even low back pain or pelvic pain. So I've got a directory for you in the description to help you find a pelvic physical therapist near you. Here's the thing. Navigating healthcare with any chronic condition can be extremely difficult, but you are so worthy and deserving of proper individualized treatment and care. Do your research. I've got some jumping off points for you in the description below. Do not hesitate to ask a provider for specific treatments or interventions. The power gradient between patient and provider can be overwhelming sometimes, but healthcare is a service industry. Don't you forget it. And finally, do not give up on your body's ability to heal. Bodies are so much more capable, resilient, and intelligent than we realize. and yours is no exception. On that note, thank you so much for watching, and please do be sure to join me on the 10th and 20th of every month for future pelvic PSAs with surprise PSAs on the 30th, where I attempt to cover an interesting pelvic health or pelvic issue related topic in 5 minutes or less. See you next time.